Hi everybody, my name is Emily. I am the Senior Marketing Specialist here at Mahaska Health, and I'm here with Renee today to talk about heart and lung health and how it relates to the COVID-19 pandemic.
So yes, my name is Renee, like Emily spoke of. I can speak for the rest of us at Mahaska Health. We miss our patients who we see on outpatient therapy day to day. So welcome to questions and whatever you would like to talk about.
So from a cardiopulmonary perspective, are there certain people who are more at risk of developing serious illness associated with COVID-19?
Sure. Not a lot of new news with this. I can say after scanning graphs and charts and talking to our physicians here, local physicians, physicians in Des Moines, I think we can be pretty positive to say that yes, lung disease, our COPD patients, our heart disease patients, kidney patients. Ultimately, we can't forget that just the full-fledged immunocompromised patients. We are definitely seen at the top of those charts for most at risk.
So keeping that in mind and thinking about all the stay home, stay safe messaging that we're hearing, should heart and stroke patients still continue rehabilitation?
We don't recommend it at this time. I would suggest just about with anything you want to communicate with your outpatient therapy service, whether it be physical therapy or pulmonary therapy or even my heart patients. Most likely at this point we have canceled those services for a limited time, of course, unless you're in acute. If you've had a recent heart attack, any type of heart intervention, I still want to hear from those patients. Should they be having any issues at home or questions that we could answer over the phone.
So again, we're being told to stay at home. There are a lot of us who maybe are not working at this point, but still want to be active and kind of stay healthy. What kind of fitness tips can you share with us now that the gyms are closed?
Well, I truly feel like everyone thinks that the antidote is to be outside and moving and focusing on getting that exercise in. Of course, I promote that personally, trying to stay away from personal beliefs. I feel like getting out the best that you can and getting that fresh air is best. Either make it just like we've seen on TV, the family events, and even if it's isolated, get outside. Do what's best for you, and obviously the common sense of the social distancing, but continue to move, especially in this beautiful weather.
Okay, so we can get outside.
Sure.
Want to maintain, that social distance, but the trails are open. We can go for walks and bike rides, and as long as we're kind of maintaining that distance away from people, we should be good.
Sure.
Okay. And so, in the grand scheme of health, diet is another really important thing to think about. Are there any healthy staple foods that people should be shopping for right now?
There are. If you are one of my patients, the first thing I will always bring up, especially when we're looking at being economical, when we go to the grocery store, staples are our best friends. Think of beans. We can buy them dried, canned. We can cook them on our own very easily. Whole grains are a great addition. Obviously, keeping in mind your diet restrictions. We want to do the best with that, but continue to think outside the box. Have fun cooking, using new seasonings, and having fun with some new ideas. It does not need to be expensive. And so I encourage new things, trying new things, and having fun with it. Introduce them one at a time and have fun with it. And so yes, definitely encouraging some new ideas with that.
And what a great way to connect with your family too.
Yeah.
I mean, trying new dishes together.
Yep.
So, all right. So is there any kind of information that you'd like patients with certain conditions to be aware of?
So what I can offer as far as education to our community with the heart disease, and let's not forget our atrial fibrillation patients, high blood pressure patients. I'd like to put them under an umbrella. First of all, continue to communicate with your provider. whether that be your specialist in Des Moines, whether it be your kidney specialist, your heart specialist, your team. Continue to communicate. They are here. They're here. They're ready to help, to serve, whether that be here or your specialists in Des Moines. So continue to pull that healthcare team together. Continue to take your medications. This is not the time to experiment with doses or trying to cut back on something. Continue to take your medications. And obviously, the major point is watching our exposure to the virus and continue to be diligent on any prevention in the home, families. It's not a fun time. It's a different time to really think about some ways to limit that. But communication is key. Providers are there. And again, we're ready to serve and help. So.
And it would be a good time to point out that Mahaska Health, as well as other providers in different places around the area and around Iowa, have implemented telehealth options. And so there are many instances where you may be able to talk to a provider, kind of an appointment, but from the comfort of your home. And so that's something that people can call their Mahaska Health provider and ask about to see if that's an option. So I do want to wrap us up with a really important question that we've heard. People see that the hospital is kind of in a very stressful time.
Sure.
That, they're hearing our messages of, asking for different resources. If somebody is experiencing what they think might be a heart attack or a stroke, can you speak to the importance of still acting and dialing 911 in
Sure,
those situations?
Sure. Before we get to that point, I know our patients are keeping it in mind, the importance of keeping optimal numbers for blood pressures and blood sugars. But sometimes we get to the point where that's just not feasible anymore. So emergency care should never be delayed at any point. Continue to use our emergency staff and services. Don't delay. Be cognitive of what you're going through and remember what you would have done prior. Continue to think that you need to seek out care and don't delay services, especially with heart attack and stroke. It's leading cause of death, and an unforeseen future is going to be, and this won't change that. So please continue to seek emergency care.
Well, thank you for sitting with us today and answering those questions. We hope to continue doing videos like this to keep you informed. So please like our Facebook page, like Mahaska Health Foundation, and Mahaska County Public Health Facebook pages for more updates. Thank you.